We will immediately jump to the next presenter, Mrs. Alexandra Skinner.
Thanks for the introduction. My name is Alexandra Skinner, and today I will be presenting my team's work on racial and ethnic inequities in drug-related arrest patterns. And so it's really hard to overstate the racial inequity in the American carceral system. You've probably heard this statistic before that 1 in 5 Black men born in 2001, so anyone who's about 24, 25 now, will be in prison during their lifetime. The figure here shows that Black Americans are imprisoned at 5 times the rate of white Americans, and overall there are nearly 2 million people in the United States who are living in prisons and jails instead of their communities. Of those who are sentenced to federal prison in the US, roughly half have been convicted of drug offenses. Of course, you all know that the war on drugs brought us here, right? We really can't separate the issues of racial inequity from the issues of criminalization of drug use. And these structures that fuel this unjust system are numerous, but I'm just going to spend this short talk focusing on police practices specifically and describing some patterns in drug-related arrests. Human rights activists have championed these calls for radical changes to policing for decades, but this movement was really amplified shortly following the murders of George Floyd and Breonna Taylor in 2020. At the same time, the conditions of the COVID pandemic were such that police contact posed increased threats to public health. Things like stops, searches, arrests, and then obviously incarceration involve close physical contact that promotes the spread of infectious disease. And so whether it was in response to this mounting public pressure to address these racist policing practices or the simultaneous stay-at-home and shelter-in-place orders and social distancing that happened during the pandemic era, there's evidence to suggest that arrests did decrease during this time. So there's an analysis that was published in 2022 by Jacqueline Yan and her co-authors that used data from 4 US cities to demonstrate decreases in nearly all arrest types for multiple racial and ethnic groups in 2020 compared to the prior year. The lighting is like making this really hard to see, but for all racial groups and pretty much all types of arrests, there was a decrease in 2020. And then despite these decreases, the authors found that the magnitude of racial inequities remained unchanged between those 2 years. And so 5 years later, our research team wanted to see if in our state of Rhode Island, which is a very small state in the US on the East Coast, right in between Boston and New York. So we wanted to see whether the decrease in arrest rates, and specifically drug-related arrest rates, were sustained, and whether arrest rates have returned to their pre-pandemic levels. We also wanted to see if there's been any progress in recent years in reducing racial and ethnic inequities in both overall and drug-related arrests, especially because there have been a few recent legislative changes in our state. So in 2021, Rhode Island reclassified drug possession of 10 grams or less to be a misdemeanor. It was previously a felony offense. And then the state legislature also legalized cannabis in 2022. So this isn't like a formal policy evaluation, but those are some important changes in the state context. And so between January 2019 and June of 2024, there were more than 104,000 arrests in Rhode Island. Almost 7% of these were related to drug violations. For context, the total population of our state is about 1.1 million people. And so we see that the overall arrest rates declined during this time for Black people. This is the green line here, Hispanic people in blue, and white people in purple. And you can especially see this dip like right around April of 2020, right in the early pandemic months. And then arrest rates do come back up, but they still remain below pre-pandemic levels. These data are a lot kind of busier. There's a lot more noise just because there's fewer arrests, but we do see a similar pattern. Again, the rates dip across the board for all racial and ethnic groups that we have here during the early pandemic months, and then they plateau just below pre-pandemic levels. But there's still this clear disparity. I mean, you can see this green line that represents the non-Hispanic Black population is just way far and above non-Hispanic white people and even Hispanic and Latino people as well. And since 2021, we did see that average monthly drug-related arrests have decreased by about 40%, but these racial and ethnic inequities obviously persist. And so we calculated the relative risk of arrest for each year for all offense types and just plotted those here. So these are the relative the relative risk of arrest for all offense types for both non-Hispanic Black and Hispanic or Latino people relative to non-Hispanic white people. And we see that Hispanic people were arrested in Rhode Island anywhere from 14 to 31% more frequently than non-Hispanic white people, depending on the year. Non-Hispanic Black people were consistently overrepresented in these arrest data by over 400% relative to non-Hispanic white people. This is a very similar plot, but here looking at just drug-related offenses specifically. And here the racial and ethnic inequities are even more stark. So Hispanic people are experiencing rates of arrest that were 17 to 64% higher than non-Hispanic white people, and non-Hispanic Black people were arrested at rates up to 6 times higher than that of non-Hispanic white people. Unfortunately, things are just escalating in the US. So while drug-related arrest rates did decrease over these 5 years that we looked at in Rhode Island, Black and Hispanic people who use drugs continue to be overrepresented in the arrest data and disproportionately harmed by unjust policing practices. The state-sanctioned police violence has only escalated in recent months, as I mentioned, as the Trump administration has now deployed federal police and military presence in several American cities. There are also some new approaches like this recent executive order that really doubles down on the criminalization-based approach to drug use and homelessness, and it has encouraged things like forced institutionalization under the guise of public safety. Of course, all these attacks on human rights at the federal level kind of make it challenging to see a way forward, but to kind of bring this back on a more productive and positive note, I want to highlight some success stories at local levels and some opportunities for state and local advocacy. So back in Rhode Island, in the city of Providence, where Brown is located, some colleagues and mentors of mine had published this paper in 2022 where they found that police attendance at overdose emergencies didn't actually provide any medical benefit. Again, it only kind of carries that risk of potential harm. And so in direct response to this work, the city of Providence now does not dispatch police at all to respond to 911 calls for overdose. So if somebody's having an emergency, it's just the ambulance that shows up. And that was like really in direct response to some of the media that came out of this study. Rhode Island is also the first state in the US to authorize the opening of an overdose prevention center. We call them overdose prevention centers, but they're the same as supervised consumption sites. And we just celebrated 6 months of this center being open to the public. It serves anywhere from 50 to 90 people a day. And so kind of my takeaway from this is if we hold racist policing practices on one end of the policy spectrum, I see spaces like the Overdose Prevention Center as the opposite end. And so the more that we can kind of invest in these spaces and foster community among people who use drugs, we continue to move the needle. And I will end there with plenty of time left.
Wow.